In three, two. All right, it's time to talk with our featured guest, Dr. Maryam Motlagh. Mary, how's it going?
Very good. Thank you. Thanks for having me here today.
No, thank you. Thank you for coming on and being a part of this. If you don't mind me asking, where are you from right now? Where are you calling from?
Portland, Oregon. This has been my home for the past 35 years, but I'm originally from Iran. We moved here to US after the revolution. So most of my education was here. I decided to stay in Portland, close to my family.
Wow. So your whole family lives in Portland.
My whole family, brothers and sisters, parents live in Portland, Oregon
That's nice. I know Voodoo Donuts,
now.
right?
Oh, yes.
Is out there. And then Dough Donuts, I want to say, is another one.
Star Donuts now,
Star
you know, Voodoo and Star. So they have crispy bacon, everything on these
Ah,
donuts.
man, Portland was one of my favorite places when we visited. It was really beautiful out there.
Food
Um,
is really great. And even the our food carts are the best in the nation, in my opinion.
I know, yeah, it is good. Do you have your own? So you've practiced. I know you went to school out there, but you do you have a practice out there or no?
Yes, I have a private practice for the past 22 years. Yeah, so I've
Wow.
been is general dentistry. You know, I see families of any age, but with a lot of emphasis on TMJ and airway issues, sleep apnea in kids and adults.
Okay, so tell us a little bit about that. Tell us about your past, your present. How did you get to where you are today?
Well, I started as a patient in dental school. I was a top honor student at OHSU, had jaw issues, popping and clicking, headaches, grinding my teeth. And so I started looking for a solution at dental school and ended up at the oral surgery department. They made me a night guard. After graduation, I mean, the night guard wasn't helping with my symptoms. So I really looked into more continuing education courses like the Spear Center that most dentists are aware of, Las Vegas Institute for Advanced Dental Studies, craniofacial studies with Dr. Dave Singh and the Vivos Institute, now the Vivos Institute, and also got my fellowship and mastership through International College of Cranial and Mandibular Orthopedics. And part of our mastership program is besides passing the exam, which I did, is to research and and dedicate to research. So as part of that program, I developed a more simple solution for addressing TMJ issues. I noticed that a lot of current options were just really invasive and not either invasive or not effective. So I developed a system that any general dentist can use easily and help their patients.
What current TMJ issues were not as effective? Like if you can recall some that were like, oh my gosh, I think we might be using those.
Well, believe it or not, and research has shown that about 30% of patients in each practice suffer from TMJ issues. Those patients in the hygiene exam that can't keep their mouth open, or the patients that have a lot of bite issues after you
Mm.
deliver a crown, or their jaw gets locked during the appointment. These are the patients, that can go on for many years, and nobody is there to really help them. Unfortunately, there's a gap between medicine and dentistry, and most of us, don't get enough training about TMJ treatment at dental school. So I think there's a problem, fear among dentists that they want to treat the TMJ, but it can be really simple. So the current solutions are either, big bulky night guards that basically deprogram the occlusion, and if the patient's bite is in the wrong position, it can lead to TMJ. I have a slide that I can share with you so I can explain the anatomy of it and then show you the treatments that are currently available.
Yeah, that'd
Uh,
be wonderful. For the listeners listening on the podcast, if you want to go in the show notes below and look at the video right now, the video format of the podcast, Dr. M has a slide or she has a presentation. And so she's currently showing it to us right now. So if you guys want to do that when you can, make sure you do that. But continue.
can you
Sorry
see
about that,
my
Dr. M.
screen now?
Yeah. Uh-huh.
Okay. So as you notice, there's a pathological occlusion in modern society is very common. All of our kids have crowding. Basically, the soft diet and the modern lifestyle in modern societies doesn't allow our jaw muscles to develop fully. So when the muscles are not developed, when we are just swallowing most of our, drinking most of our food and not chewing it, the jaws get very small, and that's why the majority of our kids have crowded teeth. Well, when the teeth are crowded, as you see, the teeth are connected to the mandible, which then affects the TMJ joint. The way the teeth mesh together can throw that joint out of alignment, and that's why you hear popping and clicking. Another problem that can come out of that is actually by moving the mandible to the wrong position, it can not only strain the muscles of the head and neck, but it can close up the airway. So later research has come up that shows that TMJ issues and obstructive sleep apnea are intimately related. And the majority of patients in modern society suffer from that because their occlusion is not perfect. If you look at our ancestors, they had all nice white jaws. They didn't have breathing issues. They didn't have allergies, to processed food. But in modern societies, we have allergies, overdeveloped tonsils, adenoids. It turns us into mouth breathers. And when we breathe through our mouth, our jaws don't develop correctly, and it can cause these craniofacial issues.
Wow. Real quick, Dr. M.
Mhm.
With this, you said it was because of modern society,
Mhm.
the foods we eat, like what, can you go a little bit deeper on that part?
Yeah, so because we don't really chew our food, a lot of the food just dissolves in the mouth, fish crackers, sippy cups, all of that.
Yeah, yeah.
Mothers not breastfeeding, it really makes our mouth to tongue muscle lazy, and it settles more in the floor of our mouth instead of the roof of the mouth. And because of allergies, hypertrophic tonsils, and adenoids, we turn into mouth breathers. So that really causes the atrophy of the bones, and that's why we have so much crowding. That's why most people's wisdom teeth don't come in. Laterals are turned. Canines don't come in all the way down. That's because we have narrow jaws. And if we address these problems early on, and we expand the palate and address the breathing issue, most of these patients are not going to have orthodontic issues or orthopedic issues like what I'm showing in this slide. Well, but
Gotcha.
unfortunately, because most of us don't recognize it, most of us don't refer our, pediatric patients out for ortho evaluation early on. By the time they're 12 or 13, their jaw has taken shape, and a lot of times they end up losing teeth, ortho extraction. That's why a lot of kids need ortho extraction. But their tongue
Mhm.
has developed to its full potential. So even though, after ortho extraction, their teeth might look nice and aligned, but a lot of them have either TMJ issues or end up with breathing issues because their tongue doesn't fit in their mouth very well.
Wow.
So
Okay.
these
So
are the things. Yeah, go ahead.
how early on should we be catching this?
Very early in a 3 or 4 year old, you need to see if they are showing signs and symptoms of mouth breathing. So at that time, if the breathing is controlled and mouth posture is corrected, they can even avoid orthodontics. So my son is 17. He's the only one in his class that never had ortho because we set the jaw right from
Yeah.
the very early on. Um,
Yeah.
so,
Okay.
you asked about options. So, these days, one of the options is surgically, advancing the mandible. We've been doing that for a long time. It's done in combination with braces. So that's one of the options to correct the mandibular posture. Other options that are being used, are these night guards or mouth guards. They're bulky, a lot of patients don't like to use them. They're limited to nighttime wear, and they really don't correct the problem. They're just managing it. Orthodontists are treating the problems, with Herbst devices. Like this is a Herbst device that you see, but what we are offering is a device that is easier for patients to wear and function with. They can wear it daytime and nighttime and accelerate that bioremodeling of the mandible that we're looking for. So in this video, you can see that the patient is wearing a myoliner, that doesn't even show in the mouth and is holding the lower jaw in the same position during function. So what I developed was basically something that fits over the teeth. It's in 3 segments. You can see 2 segments of it in this photo, and the last segment that sits on the anterior is sitting in the background. So these overlays don't need any shaving. We don't need to do any shaving down of the teeth. They fit over the teeth, and they
Mhm.
can correct the jaw posture and allow the patient to chew and function in a new position. So they can be used as a daytime and nighttime solution, or they can be used as a guide for orthodontics For example, this patient, you can see how retracted her mandible is. She was 21 when she came to me, in a perfect shape, but she had sleep apnea when I checked her. And the sleep apnea is because even though she was only less than 100 pounds, but the retraction of the mandible, the way her teeth meshed together, was blocking her airway. So by relaxing her jaw and bringing it to an ideal position, we were able to design a myoliner, which is 3D designed appliance designed to hold and support the jaw in that correct position. So she wore that for a few months. This is where her jaw is right now, and after that, now that we have the correct jaw position, we can go into phase 2 orthodontics and move her teeth to that position. So we're balancing the bite, and besides the bite, we're also balancing the body, because once the bite is out of alignment, it affects the whole body and affects the performance. There's a lot of research on it. We actually have an NBA player wearing a myoliner right now to improve his performance. And so, when your bite is out of alignment, it's like trying to run with one high heel and one flat shoe. Your whole body is out of alignment. The neurofeedback to your brain is like, there's something wrong.
Yeah.
So same with the bite, so when we bring the mandible to the right position, we actually do like a strength and flexibility test. We push down on the arms, or we check the range of motion. And on average, we see like 20% improvement. So athletes find it very helpful, because for them, it's the game of inches, so.
Yeah.
Yeah.
Wow. That's super interesting that the jaw alignment has so much to do with the whole body.
Yes, it really impacts the airway. It impacts the neurofeedback to the brain. So when your body is in perfect alignment, muscle recruitment is improved, and your brain knows that you're in the right position in space.
Yeah. Could I mean, we probably can't ask. Never mind. I was going to say, who's the NBA player? But never mind.
Oh, I can. Yeah.
Yeah.
76ers, member of 76ers.
Okay.
I can tell you that much.
Embiid? No, I'm just kidding. No, I don't know. No. Okay, no, that's interesting. Wow, that's
I
fantastic.
know that guy has had so many surgeries. He should be the next one in line.
I know that
Yes,
this
has
is
so many injuries.
so. I feel like you telling me this, as if I was a patient, I would say like, okay, can I see if I'm a candidate for this? Because I mean, can everybody be a candidate? Can I be a candidate, or how does that work?
Yeah, anybody that has the symptoms, so we recommend, dentists that we train, we recommend that they just add a few screening questions to their everyday, exams. Do you suffer from jaw noise, popping or clicking? Do you suffer from grinding or clenching? How's your sleep quality? Do you wake up foggy? If you ask people if they snore, everyone's gonna deny it. So don't ask that
Yeah,
question.
like no, I never snore.
But if you just say, do you wake up foggy? Do you feel like you get tired in the afternoon? Do you have enough energy to go work out? And if their tongue kind of like blocked their airway the night before many times, and they could never fall into that deep sleep, they're going to have those symptoms. Actually, studies on 7,000 children showed that there was a close correlation between sleep breathing disorders and malocclusion and ADD and ADHD. So look at what's happening to our society. So many kids are put on medication without addressing the root cause, which can just be an occlusion and correcting the alignment.
And you suffered from this, right? You said?
Yes, I suffer from this as a patient. So I felt like I could feel how patients feel. And on average, because unfortunately our dentists that are not taking care of this problem, on an average, patients see about 20 different practitioners in their lifetime to be able to get help for their suffering. And that's wrong. I think as experts of the masticatory system, we as dentists, we need to own this problem. Our medical doctors are not looking in the patient's mouth. They're not looking anything from neck and above. But we see our patients every 6 months. We can definitely quickly pick up the signs and symptoms of sleep apnea and help our patients. especially after this pandemic. A lot of reports came out that people with sleep apnea were actually had higher mortality rate because this was a breathing issue.
Mhm.
And, a lot of people are suffering from sleep apnea. Over 2 billion people are suffering from sleep apnea in the world, but the majority of them are not diagnosed yet. And, you don't have to be overweight to have sleep apnea these days. Just a small mouth, crowded teeth can give you sleep apnea because it doesn't allow enough room in your for your tongue. So it's really up to us to recognize it. And now, if you recognize it, what do you do about it? A lot of
Mhm.
patients, a lot of dentists are scared to treat it. But I tell you, I guarantee that once you get into it, there's so many tools available these days that can make this treatment easy for the dentist and affordable and accessible for the patient. And it's really, rewarding once you tap into the specialty treatment that's partially covered by medical. It can be really financially rewarding for dentists. We all became dentists to help our patients, to live happy lives. But on the other hand, we got a burnout, we got stress, we
Yeah.
got bills to pay. And these days, with the staff shortage, it's very hard. I see that dentists are doing their own hygiene work. They jump over to the front desk and answer, questions, help with the front desk and back. So it's very hard for dentists to keep up and just keep up with all their insurance restrictions. When you practice niche dentistry like this, that kind of like falls into a specialty treatment, you can set your own fees. You don't have as much competition. You don't have to, keep lowering your fees to get people in the door. So it's really rewarding financially for practices.
Yeah. Do you, I mean, I feel like a dentist would think when they think about this, right? TMD, TMJ, sometimes surgery, right? Or oh my gosh, I got to go through so many years of schooling, right? To perform that. I don't feel like doing that, right? So I can just how did you implement this into your practice? Where can you go wrong here? And then where can we go? How can we implement it the best way for growth?
Well, I tried practicing as a TMJ dentist. I tried all kinds of procedures that were out there, from surgery, from doing full mouth reconstruction on patients, so I tried all kinds of invasive procedures. And at the end of the day, I noticed that if malocclusion, the way our teeth mesh together, is causing this problem, we should be able to quickly resurface the occlusion and use a functional orthotic that patients can use day and night and realign their occlusion basically without the need to shave down their teeth. Because of my training, I ended up doing a lot of full mouth reconstruction at that time, and we were building in orthotics in the mouth like you make temporary crowns. But
Mhm.
with 3D technology and 3D design and fabrication, now we can do most of that in the lab, kind of like how clear aligners do, and then hand those clear aligners with the end goal in mind that this is where the jaw is going to go. So implementation is much easier. Most of us dentists didn't even need much training to implement Invisalign in our office. So it's as easy as implementing Invisalign in the office. And plus, that's why we develop an onboarding program so we can offer dentist support, clinical support, clinical consultation. And so we quickly get a dentist onboarded and they can implement it in the practice. I have several dentists that had no experience in TMJ, and within the first couple of months, they submitted like 17 cases, 18 cases. Imagine, with this treatment costing on average, what we're seeing is it costs the patient about $4,000 or $5,000. So
Mhm.
even treating two patients in practice, that's 24 patients a year. You're looking at $120,000 boost to your production with minimal clinical time. It even takes less time than Invisalign, because with Invisalign or any clear aligners, patients have to come and go for almost a year and a half.
Mhm.
But when you bring the jaw to a most relaxed position, it's kind of like a 3 months program, and then patients are done. They're either done, they can just wear it at nighttime, or they can transition into now phase two orthodontics to move the teeth to that position. So we give patients kind of like a way to test drive the bite with myoaligner.
Gotcha. So this is a great way to like boost production and collection, right? As well. I mean, obviously, like help your patients out, but at the same time to add a real tangible, like, you know what I mean? like procedure to your practice, to your arsenal.
Yes, I
Um,
mean, dentists are always looking for new solutions, laser treatment, this and that, Botox injections, cosmetics, laser, dentists are always looking. And general dentistry, the beauty of general dentistry is that you can do it all. As long as you're not claiming specialty, you can do anything, that the patients need. So this is just another way to add value to your practice, offer your patients something that nobody else offers them. And, with just word of mouth from patients, from practitioners that understand this, you quickly start getting referrals from physical therapists in the area, from chiropractors, from ENTs, because they all understand this. And when they know, in each state, there's only a handful of people that deal with TMJ. Out of maybe 240,000 dentists that we have in US, probably less than 10,000 treat TMJ. So, if you're one of them, that means that you have a lot of patients, a lot of demand. There's a lot of demand out there.
yeah. Yeah. I 100% agree. So you charge typically 4 to 5,000, right?
That's what we have seen. We have a doctor that is contracted with the VA, and the VA really likes this protocol. So they're sending him like 15 patients a month. So he's reduced his fee to about 3,500, and is still very profitable for him.
Yeah.
So
So, uh-huh.
you can't compare it to an average night guard. With a night guard, you spend 15 minutes on a patient, and it's just a flat appliance. With myeliner, you're helping their jaw in a more comfortable position. So yeah, on average, what we're seeing is 5,000.
Okay. So where can we see, like, I guess, a struggle here? Or like, where have you seen some hiccups? If it's like, oh, there's a hiccup because maybe you're not well versed, or maybe your front office did something, or maybe something went somewhere wrong on the diagnosing. Where do you see that?
It's usually not on the diagnosis. What we've seen on the hiccup side is like uploading. We're fully digital, so uploading the STL files, doing a digital file for dentists is still new. So we changed that by accepting, impressions or molds. So we can turn it into a digital file. But a lot of dentists still haven't implemented digital dentistry scanning in their offices. So that's the one hiccup we've seen. And just the learning curve is just very small, and as I said, we have launched kind of like an online onboarding program that we can help dentists learn, and we have a lot of videos on how to deliver and things like that.
Gotcha. So basically, the person or the practice owner, or like the dentist, right? Let's just say the associate or whoever, scans it like
Mhm.
that, and then they send. You're watching it.
No, we're not watching it. They scan the jaw, and then
Mm-hmm.
they upload the SDL files through a HIPAA secure portal. So it comes to Myeliner Lab, and then they either get a clinical consultation with an advisor, or if they feel comfortable, they'll go ahead and proceed with making the appliance.
Gotcha. And then the return time is how much? How long?
Usually 3 weeks, because we serve all over US, so it's 3 weeks including shipping.
Yeah, nice. So how long has MyoLiner been out for?
Well, we launched last year, middle of last year. I filed for the patent a few years ago, and we did our FDA inquiries and all of that. We worked on the manufacturing. So I was working with a handful of TMJ experts, in the kind of like a trial phase. So it's been around for a few years, but it was just only available to a limited group of dentists. As of last year, midsummer last year, when we got our US patent, then we had a soft launch, and we also launched the onboarding program because we noticed that these patient dentists needed a few hours of training before they could put it in their practice.
Gotcha. What goes behind all this, Dr. M? Like the
Oh my
launching of the
God.
patent, like how are you balancing that with your practice, then your family? Like what goes behind all of it?
A lot of hours and a lot of planning, a dedicated team. And because it's a technology company, so as far as we have an education arm, that teaches the dentist through Myeliner Academy, and then we have the manufacturing that needs to keep up with all the support tickets and everything, and quality checks. So it's a lot of work, but just seeing patients get results, and seeing dentists thrive on this, it just it's a great feeling. So it keeps us going.
Yeah.
Yeah.
Throughout the process, where can you remember where you're like, oh my gosh, I just gonna leave it at this. I'm just gonna do it in my own practice. I'm not even gonna worry about making this come to fruition, myoliner. Where bring me back to that moment if you had one of those.
Oh, we decided to bootstrap this. We didn't raise money early on, unlike most companies that before their product goes, is even launched, they raise a lot of money. So there was times that, it was just really tough to keep up with the growth. And so, sometimes I question myself, I'm like, is it worth it? I worked so hard, but it pays off, at the end of the day, when you see that it is my mission, it is my destiny to get a lot of people out of pain. I was seeing the results in my own practice, and it just broke my heart to see kids coming in suffering from this, a lot of adults coming in angry because they spent hundreds of thousands of dollars on surgery and other invasive treatment, and they were still not getting enough relief. So it was just my destiny to do something about it. And just what was working in my practice, luckily with the help of a good team, I was able to bring it outside, of my practice to the world. And our mission is really to empower general dentists to be able to offer these simple solutions to their patients and get them out of pain and hopefully impact public health. Because with the number of patients that are suffering from this in modern societies, if we all really team up, and start screening patients, and even if the dentist is not comfortable treating it, just screening and referring to the right practitioners is going to make a huge impact on public health.
Yeah. Yeah. It's gonna be it is. It's fantastic. I can only imagine like someone coming to you after getting the surgery done, right? The one you showed me with the in the
Yeah,
slide,
the herbs. Yeah.
and then coming and being like, I still get the same problems after doing all that. You know what I mean? And it's like, what happened? Where did we go wrong? To do this, you know what I mean? Myoliners, where it's really not invasive that much, not at
It's
all.
not invasive. It just snaps right on top of your own teeth. We just teach the dentist how to relax the jaw, or if they already know how to relax the jaw and find that optimal bite, they just send us the models, and then we build these to that position. So because the myeliner is segmented, it doesn't put a lot of torque on the mandible. That means the patients can chew with it during the day. So it's kind of like denture for people with teeth. It just corrects their jaw alignment by correcting the occlusion. So they can wear it during the day, and it's compatible with sleep devices. A lot of people that are in sleep devices or expanding their jaw, because myeliner is segmented, it kind of like rides with the expansion at night. So that's why, we're doing so well. We have channel partnerships with a lot of sleep companies that make sleep devices, and it just goes hand in hand with sleep. We recently launched, had our first conference here in the Northwest called Sleep and TMD, because they're related. And we sold out like in 3 weeks. We just have a few more spots left. And it was just amazing to see how demand, there's so much demand for it. Dentists are starting to realize that too. So they're educating themselves more on sleep and TMD.
Yeah, I feel like sleep blew up like out of nowhere. Like in the past, like I want to say 3 years, maybe like when the pandemic hit, maybe people were more aware of it because they're always at home. I don't know what happened, but it just blew up, right?
Besides that, these kind of like at-home night guard companies, there's
Mm.
several of them blew up too. Startups blew up because after the pandemic, people were grinding and clenching a lot. Basically, if your airway is compromised, research has shown that you start grinding. It's not all stress related. You grind to open up your airway. So because the pandemic affected the airway so much, people were grinding more. And on top of that, the stress, the economic stress and that people suffer through caused more grinding. So it's kind of like somatopsychic and psychosomatic problem. So just my message to dentists is just to screen for it. You're the ones that you see the patient every 6 months, not their medical doctor. And there's so many signs and symptoms in the mouth that you can quickly screen it And these days home sleep studies are so inexpensive. Under $300-400, you can have a home sleep study done for your patients that is diagnosed by physicians, by board certified sleep physicians. So the dentists don't even have to do that. Yeah, we're not licensed to do that, but with the home sleep kits, they're usually connected to physicians, and you can get a diagnosis, and you can put your patient in a sleep device, or if it's causing TMJ, in a myeliner, and help them. There's a lot of demand, and if you want freedom from dental insurance companies, if you wanted to increase your production per hour, specialty treatment like this is, another option to look.
Yeah. Do you, in your practice right now, are you accepting all kinds of insurances, PPO, or what do you do?
The majority of insurances, but not really the discounted one. So and we bill medical a lot. That's nice because when you get into sleep and TMJ, you can bill medical and they don't have as much restrictions. And you don't even have to bill medical when you do this type of things, as long as you kind of like reuse the right codes. You can give it to your patients and they can get reimbursement from their medical. So a lot of our patients, the way it's in our office, they pay cash for their treatment, and then we'll give them a super bill and they get reimbursement from their insurance.
Wow.
It's harder
Okay.
to estimate with medical. With a crown, the insurance covers 50% of your fee, for example. But with medical, it's different. So it's usually a range, and we just don't want to be caught in that. So, the patients pay us. But compared to surgery or other invasive treatments like full mouth reconstruction, that is $60,000-70,000,
Hmm.
it's much more affordable by majority of people.
Oh
Or
yeah.
either finance $5,000, or or use these financing companies that are available.
Yeah, definitely. So real quick to recap, the screening questions. I know you said it's really you said it's real easy. We need to ask and and screen the patients, right?
Yes.
The questions is more what we're looking to do. I mean, I know we're looking for stuff when we're doing like their new patient exam and things like that, or we're checking them out again. But it's mainly the questions that you're asking, right? Like, oh, how's your sleep, or what do you think?
Yes, yeah, it's a few questions that they answer in their medical history. And as a hygienist or me are working on them, I'm like, okay, the scalloping of the tongue, I see quite a bit of scalloping of the tongue. It looks like you're chewing the inside of your cheek, So for the symptoms, we ask them the question, they give us and that's a conversation starter. And then for the signs, we can look at them in the mouth to see if they have a narrow palate, to see if their mandible shifted back, closing their airway. So those are the signs that the dentist looks for. And you can usually, when you see this, you can usually bring the patient back in for more of a comprehensive TMJ exam. It's usually covered by dental insurance, another exam. So you bring them back in and do that, and then you can offer them a treatment plan presentation. You do a treatment plan for them.
Okay, awesome. So transitioning a little bit here, I want to kind of dive a little bit deeper into your practice, right? How you're
Yes.
implementing this, how it's making it happen, and things like that. Right now in your practice, well, first and foremost, was it acquisition or a startup that you did?
Um, I bought an existing practice, but it was only like 4 or 5 years old, because the dentist got accepted to endo school. He wanted to become a root canal specialist. So it was pretty new, but quickly I started to boost production with the extra services that I was offering
Gotcha. This was
to
one of
the same
them.
patients, to say yes to the same patients. So 30% of patients in an average practice with 2,000 patients, that's 600 TMJ patients that were sitting in that database, but the previous dentist never took care of them, never brought it up. So I was able to quickly turn those patients, convert those patients into, clients that needed this, that could benefit from this treatment.
Yeah. Okay, awesome. And then what type of practice do you have? It's general or is it fee for
It's a general
service?
dentistry. I have cut back quite a bit. So I have a partner that also does airway. So I would say about a third of our practice is kind of like general dentistry, and a third is TMJ, another one is airway. So it's very productive. We both work part-time, less than 2 days a week, but our take home is probably similar to or more than an average dentist that sees about 40 or 50 patients a week. Because, as I said, production per hour is higher. We don't have to spend as much chair time, and you can get to set your own fees.
Yeah, that's nice. So right now, if you can pinpoint, what system would you say is unique in your practice where you are like, we made this system just for this practice. It's beautiful, it's unique. It makes everything efficient or it grows. What system would that be?
Uh, Patient education, basically from the time that they walk in. My front desk knows how to ask the right questions from the moment they call. So we have actually a and with the turnovers these days, we had to type up everything, all those questions. So even I have a brand new patient, she can ask the same questions that somebody with 30 years of practice could ask. So make sure that front desk is makes or breaks the deal. Make sure your front desk personnel is educated, even if they have to read from a note, and ask the right questions from the patients. And then we spend time educating them, through a nice, we don't rush through a hygiene exam to bring this up. If I see the signs and symptoms, then I'll bring them back in for another appointment, which I can dedicate about an hour of my time educating them. And once you educate, you don't never have to sell anything. Patients will demand it, and then that way they can make an educated decision and they own their problem. So spending time on that is very important. Also, then the typical things for advertisement. When we are on our website, we try to set ourselves apart by offering services that our neighboring dentists don't do. So on social media messages, on your website, it is it is the face of your practice. So you need to make sure that your message is clear for your patients.
That's good. What are you currently doing for marketing and advertising? If you can tell me like, oh, this has brought in us in the past years a lot of great success, and then this didn't work that well.
Because I've been in practice for almost 20 years doing this, I don't actually do much marketing. A lot of it is word of mouth and referrals. So as I said, because not majority of dentists in your state are not doing such work, as soon as you start doing it, then people are going to talk to their neighbors, to their family members. They all have patients, or kids that have sleep apnea. They have kids that are going through braces. So the word spreads, and what I did originally was to um, go and visit the chiropractor in our neighborhood, and the physical therapist, and just establish some relationship with them. And then they became the source of referral for us. So I have like surgeon's office, ENTs, and physical therapists that refer patients to me all the time. The only thing that we've tried to keep up with is the SEO. So our website comes up first when people are putting the right keywords in.
Gotcha,
And that's, I
gotcha.
think, worth it. But it takes a while,
Yeah,
and but it's worth it.
awesome. So, Dr. M, I know you've been, like you said, practice ownership for over 20 years, been in the industry, been doing a lot of research, studying, and everything like that. To you, throughout this process, what do you feel have been some of the best companies you've worked with, and then some of the worst companies, or ones that just didn't fit your mission?
um, Instead of naming companies, I will just say, I used to do like mailers. That was ineffective. I felt like, a lot of money went into mailers, and the return was not good. What I have used, what has been really effective has been social media, bringing more awareness through social media, through the website. Articles, when I'm featured in articles, that has been really helpful. You can talk about, you can write blogs. Those are very effective. A lot of people read those. You can hire PR. That's one thing that has been very effective, and just get published. And get an interview in the One of the best things that I did in like 2005 or six was I got a spot on AM Northwest, and they talked about it. So people still watch that video, even though it's like
Mhm.
almost 20 years old. So those are very effective so people recognize your face and remember your face in the community. You just want to be that dentist that they think of, when these things are brought up.
Yeah, especially like TMD, right? TMJ. I think that's like really fantastic that
Yes.
you
If
went
you
to.
ask the majority of dentists how do they treat the TMJ, they either don't do it or they just do a night guard. Majority of listeners are probably that's what they're doing. And night guard, it costs what, 200-300, probably $150 for lab cost and $500. So look at the profit margin on that. But when you do an orthotic and realign the bite, profit margin can be $4,000.
Yeah. Has it ever occurred to you, Dr. M, or like has this ever happened where people like go to maybe like a seminar, they're listening maybe to this episode, they're like, that's it. I'm gonna do it. I'm gonna implement this team. And then a month later, they're like, oh yeah, we're trying, but here and there, and then 2 months later, they're like, oh, we're busy with other things, but we're trying. How do you maintain the consistency and the motivation high?
That's a very good question. I think if they get their team involved, because dentists are busy, as you said, they get busy, they forget about it. And if they get their team involved and they get that team motivated, they can implement things in the practice much faster. I noticed a lot of conferences, the dentists come to the conference, they're super motivated. And then when they go back, in just that half an hour or 15 minutes of huddle, on Monday morning, you cannot deliver the message that you learn in 2 days from experts. So, you go with all this excitement and the staff is like looking at it, oh gosh, another thing to learn, that's probably not going to be effective. So
Yeah.
take at least one team member, to these seminars so they can see, they can feel the energy, they can feel the power, they can see the cases that the experts have done. And so they can kind of like share that excitement with you. And then as part of our onboarding, we're actually offering the first myeliner free because we like the doctor to use it on a team member that is suffering. Then that team member has something to talk about. That's why originally when we did like clear aligners, we put every team members in a clear aligner. They were talking to the
Mhm.
patients about it. They're there, and they say in Mark, a patient needs to hear something like 7 times before they make a commitment. So they hear it from the doctor, they hear it from the assistants, they hear it from a team member up front before they can take an action. So get the team involved, in my opinion.
I love that. You're right. When we were doing Invisalign for the first time years back, they're like, Michael, you want to do it? And I'm like, sure. You know what I mean? And
Yes, they
I'll
love it.
I'll definitely do it. And
It's usually free for team or they just pay the lab cost, and so it's a great deal for the team members. Like every single team member in my office, I know they are either in a myeliner or they're in a DNA, mRNA when we're treating their sleep. So when they see the impact on their own lives, they're going to share it with the patients. And they're there too for the same reason. They're there to help patients. So when they believe in something, when they experience it and saw the results, they're going to share it.
gotcha. So that's what we want to do. Get them motivated. And if we even could we even bring them to the event or one of the
Yes,
or
most of the times, most events are open for team members too at a huge discount. They basically charge for their food and accommodations, but usually classes are at a huge discount for team members, and I think it's very powerful.
wonderful, wonderful, awesome, Dr. M. So last question, one of the last questions I wanted to ask you is when it comes to the onboarding process for myoaligners, how does that work? What's the cost for us or what the practice owner? What are we looking for at that rate?
Yeah, they can go to myliner.com, and click on I'm a doctor. Then it will just take him to Myliner Academy and under, offers, and they can see different packages. So, the main onboarding includes about 3 to 4 hours of classes online, which are each half an hour segments. So you can after each segment they can answer a few questions, and that way they get their AGD because we're AGD approved Academy of by PACE, Academy of General Dentistry. So after they do the classes, then we do a lunch and learn for the team. We buy them lunch. We show the team, we give them a PowerPoint presentation, what it is, how it can affect their practice, who is the candidate, what they need to look for. And then they submit their first case, which is usually among team members. And with that first case, again, comes with a consult for the dentist and continues on. And we also give them like a promotional package and everything. So our our onboarding is set at about $6,000. But usually through channel partnerships and stuff like that, there's some discounts. Where that's what with the seminars coming up, with the Airway and TMJ seminar, it includes the onboarding too for them. So once they go through that, which just usually takes about a week, by the time they finish their own classes and things like that, they're ready to implement it. And with the first case, that should pay for their onboarding. I went to LBI, ECMO, Spear. So if I add up my hours, I probably spend like easily $200,000-$300,000. And if you talk to most TMJ experts, that's how much they spend. So we try to keep the cost minimal for dentists. And as I said, most dentists are charging an average of $5,000. So it pays for the first case pays for it.
Yeah. Wow. Wonderful. Wonderful, Dr. M. Thank you so much for being with us. It was a pleasure. But before we say goodbye, can you tell our listeners where they can find you?
Yes, myoaligner.com. That's where you can find me, and just message us. We have a really great support system. So if you have any questions, message us, and within 24 hours, one of our team members will reach out to you and answer any questions.
Awesome. Awesome. All righty, guys. So that's all going to be in the show notes below too as well. And Dr. M, thank you so much for being with us. It was a pleasure, and we'll hear from you soon.
Thank you very much.